The impact of OCM, or the oncology care model, on large practices that are conducting clinical trials remains an unknown. I'm hopeful that in fact it'll be a positive, and that these large practices that are great accruers will in fact use the OCM model to better identify those patients and better care for them. At Sarah Cannon, certainly some of the larger practices participating in the OCM model are key to our accrual, practices such as Tennessee Oncology and Florida Cancer Specialists. On my concern side is that adhering to the oncology care model detracts from taking time to consider a patient for a study, or thinking that a patient in the oncology care model isn't a good patient to be included in a clinical trial. That's not the intent of the OCM. Actually, talking to some of the folks that created the OCM, they're hopeful that they'll see a large participation from patients participating in studies. But I think we need more education about the role of clinical trials in OCM. We need a better understanding that it's not a negative, that it could be a positive. And lastly, we need greater transparency into how OCM feels about those patients that are in clinical studies.